Hello everyone, welcome back to the podcast of Bajaj Dental and Aesthetics Studio. And I am your host Dr. Vritti Bajaj Khanna. Today we're going to talk about root canal treatment. लोगों को बहुत डर लगता है, but let me tell you, it is one of the most convenient treatment to save your own teeth. If you have a choice of saving your own teeth and giving it up, I would prefer as a professional to try saving for once. Because a God-gifted teeth should be saved till the last. A root canal treatment is now completely digitalized and is not as traumatic as years ago. So, currently we take one or maximum to maximum a 2-sitting procedure so that it is convenient for you and it is less time consuming. A digital root canal is now done with an apex locator which can actually locate the exact end of the tooth apex, causing you no or minimal discomfort. Apart from that, we have other machineries which can digitally clean the tooth and can be more effective than a manual cleaning. So, before turning on to how a root canal treatment is done, let's first learn about how does your tooth look from inside. So, by cross-sectioning of a tooth, your tooth has 3 layers. The outermost layer is called the enamel, the second layer is called a dentin, and the third, that is the innermost layer, is called the pulp. Your pulp has all kind of nerve endings and blood vessels. So, if the infection somehow reaches to the third layer, the innermost layer, that is the pulp, it causes pain. The first 2 layers are the dead layers of the tooth. So, relatively, there is no pain and discomfort. But when the pulp is infected, it creates a lot of pain and discomfort. In this case, a root canal treatment is done, followed by crown. There are some canals that are followed by the pulp chamber into the roots of the tooth. And when the pulp chamber is infected, the bacteria may pass down into the canals. So, in the treatment, we do treat the canals with irrigants and disinfect them with all the instrumentation. Therefore, your teeth becomes free of bacteria and definitely free of pain. Currently, the costing of root canal varies from place to place and scale of the doctor. It may start from somewhere around 3,500, goes up to maybe 15,000 as well. Depending upon what vicinity do you stay in, what doctor is doing it, what is the skill of the doctor, and trust me, the more skilled the doctor is, the heavier would be the charges, but the more is the success rate. Coming down to the success rate of a root canal treatment, let me tell you, there is absolutely no warranty or guarantee given in any kind of root canal treatment. Reason being is, we are actually trying to save a natural tooth by doing a man-made treatment. So, somewhere in the middle, your immunity plays a huge role. Nobody can actually tell you how long will the treatment last. But if you do take care of your teeth and if you do proper checkups and get proper cleaning of your teeth, maintain a proper oral hygiene, the teeth might last up to a lifetime as well. Apart from that, there is one major thing that you need to follow if you have undergone a root canal treatment or have to undergo a root canal treatment. That is, do not bite anything that is very hard, like almonds, like chanas, because they are too hard for your teeth to take up the masticatory load of such materials. In case you have undergone this procedure, avoid eating things, avoid eating eatables that are too hard to chew, and also do get a crown on your root canal done treatment so that the lost structure is regained and the tooth can be completely saved from all ends. Thank you. Look up for your better smile and contact us for anything else if you wish.